All right, amigos, welcome into chapter 16 today. Today we're going to talk about splinting extremities. So first off, what you need to know about splinting extremities is that at all possible, you should try and splint whatever injured extremity in the place in which you found it. Okay. There are very few exceptions to this. The biggest thing to keep in mind is, when it comes to bony and musculoskeletal injury, typically it's not the damage to those structures that's the problem. Although, damage to bones, it can be a problem if it's not splinted correctly, can lead to some debilitating stuff. But in the short term, what we're worried about most is the structures around said injury. Okay, especially being near major organs, near major blood vessels. Anytime we move that injury, we are at risk of causing damage to surrounding structures. And major blood vessels, like in your neck, like in your arms and in your legs, people can bleed out if you puncture those. So you need to be very careful. The biggest point of stabilization and why we do it is we're trying to minimize further injury, right? Like, this person's already been injured. We don't want to make it worse by any means. And so that's really why we splint stuff, is to prevent more problems. All fractures especially should be stabilized before you move the person. Okay, again, just trying to prevent further damage. Just to add a little caveat to what I said before, the only time you would move an injured extremity is if blood flow is compromised. If CSM is compromised, circulation, sensation, movement, then we're going to be more concerned and we may move the extremity. All right, a few more reasons why we splint. To reduce pain. Anytime you have a fracture, especially, or damaged tissues, moving those tissues is just going to cause more pain. So minimizing movement to prevent pain. Again, prevent further damage to surrounding tissues, muscles, nerves, blood vessels. We want to prevent a closed fracture from becoming an open fracture, from breaking the skin. Reduce bleeding and swelling, and again, those symptoms from damage and tissue damage. And preventing, again, damage to those surrounding tissues. So this is a quiz question. Make sure you understand these next couple slides. We're going to talk about the different types of splints. Now, these types of splints do apply to all body parts, and in one form or another, you could use all three of these splints for nearly any body part. Okay, so the first type is a rigid splint. It's a device that's not flexible, and it's really used to maintain stability. It must be long enough that you can secure above and below. And we're going to talk about the rule of thirds here in a minute and how you apply a splint, and that will kind of get more into that. Okay. And then, so for the first example of a rigid splint right here, we have a SAM splint. We use these a lot as athletic trainers. I wish I had you guys in class because I could show you guys how this works, but it's really nice. So it's foam that has aluminum on the inside. So when it's rolled up like this, it's really easy to flex, but when you flex it long ways like that, it becomes pretty rigid, and it doesn't bend the other direction well at all. And so it works really, really good as a quick splint because it's moldable, and I can modify it for how I need. So the next type is a soft splint. Typically, we'll use a pillow for a soft splint. It's very good for the lower leg or for the forearm. This helps protect it from being damaged from other sources. But, again, because it's a soft splint, the person can move it. So using this on like kids and stuff like that may not be the most effective because they don't understand that they need to hold still, right? The last type is called a self-splint or an anatomic splint. Basically, you're just splinting one part of the body to another part of the body. Okay, that's an uninjured part of the body. The most common type we'll use is like a buddy taping for fingers. If this person jams this finger or breaks this finger, often we'll tape it to the other side. You can use gauze in between the fingers to help prevent rubbing and blisters and stuff like that. But it really helps prevent some of that movement. The only limitation to these, for one, if it's not near another body part that can make it an uninjured body part that can make it difficult, or you may would have to put somebody in an awkward position, and that's not ideal. So that's one limitation. The next one is the person can move the uninjured limb. So if they move it, they're going to move the injured limb, and that could be a problem. So again, probably better used for older individuals that understand, like, look, you still need to hold still, those types of things. Or you could use it in conjunction with a rigid splint as well. All right, guys, so before we get too far into how to actually apply a splint, I just wanted to let you guys know, as a first aid provider, you have to be willing to get creative. We don't always have commercial manufactured splints right in front of us. A SAM splint isn't always available, right? We don't always have all the materials that would be the most ideal. But being able to be creative to make something work is going to be very necessary as a first aid provider. Okay, so as far as actually applying a splint, make sure that you stabilize any sort of fracture or dislocation before you move the person. If there's any open wounds, we want to deal with those. Cover them with a sterile dressing. Make sure that we're checking for circulation, sensation, and movement, CSM. If any pulses are absent, try to gently line up a fracture or dislocation. That's really the only time, again, I mentioned this earlier, this is the only time you would move a fracture or dislocation is if circulation or sensation is absent. Try and gently line it up, but don't force anything, okay? And then above all, when you're going to apply a splint, make sure that you are communicating with the person. Hey, this is what we're doing. This is why we're doing it. This is to help you. Are you okay with that? Okay, and that will prevent a lot of problems. When you try and move stuff before somebody's ready, they tend to jerk away or get really upset, and it just causes more pain and possibly more damage. All right, so when applying a splint, we're going to use what's called the rule of thirds, okay? Basically what we're going to do is we're going to take the body part, okay? So we'll take the body part, this guy's arm right here, and we'll divide it into thirds. So if we, for the forearm, for example, if we have a fracture, so we'll divide this into thirds, okay? We have the distal third, the middle third, and the proximal third, okay? If the fracture is in the middle third, okay, the rule of thirds states that you have to stabilize the joint above and the joint below. Or if we're talking distal or proximal, the joint above and the joint below, okay? If the injury is in the lower third, you have to stabilize this joint up to the middle of the bone, okay? But you don't have to stabilize this joint, okay? So, depending on where in the bone or the structure the splint needs to be placed or the injury is, okay, will determine what we have to splint. Okay? Perfect. So next, if there's two of you present, make sure that one of you is supporting the injury site while the other one is working on the splint to try and minimize any sort of movement. When possible, we want to splint both sides of the injured part. So for example, this person's leg, they used a rigid splint and they wrapped it on. Okay, so they put a rigid splint on both sides. Okay, if it is not possible to put a rigid splint on both sides, just use one. Okay, but this goes for any sort of joint injury. We want to try and splint both sides if possible. Okay. Make sure you apply them firmly, but do not restrict blood flow. you want to continually be checking circulation, sensation, and movement. Checking for those things to make sure those are not compromised, okay? Once it is stabilized, then we're going to go ahead and use the RICE procedure, rest, ice, compression, elevation, if you guys will remember. We want to elevate it, try and prevent excessive swelling, and those sorts of things, okay? If there is no pulse, we are not going to apply ice, okay? If there's no pulse, it's an emergency, right? And they need to be seen ASAP in an ER. But if there's no pulse, all ice does is slow down blood flow. And so that's going to make it even worse and could lead to tissue damage. So we're not going to do that if there is no pulse. Reasons you should seek medical care: open fracture, any sort of dislocation, a joint injury with moderate or severe swelling. So if it swells up a whole bunch, anytime there's deformity, severe tenderness, or severe swelling, or if the person is unable to walk or bear weight. Okay. You do sort of want to take all of these with a grain of salt. Okay. This is the hardest decision, even for me as an athletic trainer, but really for any injury in general. Do I go to the doctor? Do I not go to the doctor? Okay. So you do have to be smart with all of these. Some of them are very obvious, some of them are not. Okay, so make sure you understand these. Okay. Anytime there are snaps, crackles, pops with movement, that's a concern that we need to get looked at. Okay, if it's hot, tender, swollen, or super painful, if there's a lot of inflammation, which we talked about inflammation, that's a reason to go see a medical provider. Okay, if you believe it could be broken, that's a good reason to go see a doctor, okay? Because fractures need to be stabilized to allow them to heal properly, okay? If it does not, this is probably the biggest one. If it doesn't get better fairly quickly, you need to go get seen, okay? A couple years ago, I was playing in an adult tackle football league. It was fun, but I don't think I would do it again. I went to make a tackle and my pinky finger got stretched out pretty bad to the side medially from the anatomical position. And I really thought I just injured some soft tissue or something right there. I didn't think it was a huge deal. But it hurt. It swelled up pretty good there in the beginning. But when I touched the bone and stuff and did some of my fracture tests, that they were negative. So I thought it was okay. Well, it continued to bother me for about a month. And I was like, all right, I really need to go see a doctor because I'm afraid this might be broken. He's probably just going to give me an anti-inflammatory or something to try and get it to go away, but you never know. So I went in. Sure enough, I had a little teeny tiny fracture that because I hadn't stabilized it was not healing. It had started to heal a little bit, but not much. So we splinted it up. After 4 weeks, it was just fine. Okay, so that's the biggest thing is if there's really no rapid improvement or it continues to get worse, go see a doctor. Okay. All right. So we're going to talk. I have a picture of this in a couple of slides, so we'll kind of come back to this. But you can use a triangular bandage as a sling for shoulder injuries and upper extremity injuries. Okay. A folded triangular bandage, which is called a cravat, can be used as a swath in conjunction with a sling. And I'll show you this here in just a second. So we're going to talk about splinting specific areas. We're going to start with the shoulder, So your shoulder includes your collarbone, your scapular, your shoulder blade, and the head of your humerus, so your upper arm bone, okay? How to splint these, we're going to use what's called a sling and swath. So a sling and swath, okay, this is a triangular bandage, right? It's just cut in the shape of a triangle, okay? Your triangular bandage, you're going to wrap it around the arm, bring it around the neck, and tie it together like this. Then you're going to take another triangular bandage, fold it point to the middle, and then middle to the end again to create just a long, kind of a skinny bandage. And that's what you wrap around the person's body and tie together to help trap their arm to their body so that it's not out swinging. So that is how you create a sling and swath with a triangular bandage. All right, we talked before, and I feel like we've hammered it a million times, but make sure we're checking CSM continually throughout the splinting process. In the sling and swath especially, make sure that the patient's hand is thumb up. We talked about how to make a swath, using the triangular bandage and folding it into a cravat 3 to 4 inches wide. Okay, and tie it around the upper arm and chest of the person. In the case of an anterior shoulder dislocation, so the person's shoulder dislocates forward, you would place a pillow or a wool blanket between the arm and the chest to help cushion that a little bit. Use cravats or a roller bandage to secure the arm to the chest. Essentially, you're just going to swath it. You don't have to put a sling around it. Okay. Basically, find the way the person's most comfortable. If that is with a sling or without a sling, whatever that means, make it work. For the humorist, if somebody breaks their upper arm or has a fracture of their upper arm, we're going to put the splint along the outside of that upper arm, and then we're going to put a sling and a swath over the top. Okay. A forearm fracture, we want to work on putting splints on both sides, kind of like that picture of the leg that I talked about. This helps keep the forearm from twisting or rotating. All right, as far as wrist, hand, and finger splinting, there's 3 different ways. Okay, you can take a rolled pair of socks or a roller bandage and place it in the person's palm. And then attach a rigid splint over the top of that. Or you can just wrap the person's hand up with a roller bandage after that. Okay. You could mold the pillow around the hand and forearm, tie it down with cravats or a roller bandage, or you can buddy tape fingers together. Okay. Pelvis and hip, simply wait for EMS. There's not a good way to splint these. If you are in an area that's remote, do your best to try and transport the person without a lot of movement is really the best way to do it. Okay. Femur splinting, a traction splint is the best way to do it. We as first aid providers are not going to have access to a traction splint. They're pretty expensive. An ambulance would have one, EMS would have one. Basically, you're going to call 911 immediately, tell the person not to move. You can apply some ice while you're waiting for EMS, as long as there's no lack of circulation. Okay. Splinting a knee, again, same idea. We're going to try and splint it in the position in which we find it. This is kind of where you have to get creative. If it's straight, we can use a rigid splint, like on the right here. If it's bent, you can tie a rigid splint around a bent knee, sort of like this. This is wrapped around here and then tied around the middle. And you go through you go here through the middle and tie it here as well. Okay, so you just kind of have to get creative. There is more than one option for a straight knee. Besides the picture that I showed you, you could do a long padded board that goes all the way from the hip to the ankle. You can do 2 boards like that picture I showed earlier. Or you could use an anatomical splint by tying the injured leg to the uninjured leg. Okay. For a bent knee, we could use the method that we saw on the last slide with a long board from the hip to the ankle. Or you could place a pillow or a roll blanket beneath the knee and then tie it together that way. Okay, you just got to be careful not to put too much pressure. Stabilizing the lower leg, using 2 rigid sprints or 2 boards from the upper thigh to the bottom of the foot. Or you could place a folded blanket or a pillow between the person's legs and then use an anatomic splint, tying it to the uninjured leg. Last one we'll talk about, ankle and foot splinting. Ankle and foot are very conducive to using rice because it's easy to elevate and ice and those types of things. Good stabilization is using a pillow with cravats or triangle bandages. If you have access to an ankle brace, that's great. Or an ACE wrap works really good just to kind of help prevent some of the swelling, but it's not very stabilizing. Okay. That is the end of our splinting chapter. Thanks. If you have any questions, please reach out. See ya.